crazy patient encounters are always the highlight of dinner conversation. Stay tuned for some really crazy stuff. Patient encounters, through the years of training, many years as becoming doctors and plastic surgeons, there's so much stuff out there that we've had with just patient encounters. And it gets to be the fact, especially in your training, where you just feel like this is happening to everybody every day. But what you find when you're talking to your friends that maybe aren't in medicine, they're like, oh my God, tell me more of those stories. The first one was from my plastic surgery training. I trained in Dallas, Texas at Parkland Hospital, University of Texas Southwestern plastic surgery program, arguably one of the best plastic surgery programs in the country. I trained with some incredible people, but we were a replantation center. And what that means is when people cut off arms, fingers, other body parts, they send them to us to put back on, to reattach. And there was a person that was actually in Fort Worth that was on the top of a building, and there was some big exhaust fan, and his hand got caught in the exhaust fan, and it cut off his arm right at the wrist. And so that is something that it's actually an emergency to be replanted or a blood supply reestablished as quick as possible. And so we ask the usual questions. And one of the things is, well, do you have the part? They cut it off, but you need the other part, the part that got cut off, to put it back on. And they're, well, we don't have the part right now. We're looking for it because it went down like 5 stories onto the road. Then a couple minutes later, they call back, well, we actually have the part, but it got run over by the Fort Worth garbage truck. Now, this is a true story. But anyway, we had them prepare that and send it, and it gets to the ER, and we look at the hand that's been cut off, and it's got a tire mark on it, but it was a relatively clean cut. It was a fan cut, and so we went up to the operating room, and it's a multiple surgeon team procedure, so there's at least usually 3 to 4 highly trained microsurgeons that start that procedure, and you take the part and you identify all the different structures. So in just a hand replant, there's a lot of different things. There's the bone, there's the tendons, there's both flexor tendons and extensor tendons, there's the arteries, there's the nerves, there's the veins. So there's a lot of different structures. You identify all those things, and then in the meantime, the patient's being prepared. Luckily, this was a young, healthy patient, so there's not a lot of preparation, but then the patient goes up to the operating room, gets placed under anesthesia, and then what we do is we prepare the arm and identify all the structures, and then we start putting those back together. In this case, it probably took somewhere between 6 and 8 hours to totally put that back. That person did very well. Their hand lived. They did lots of therapy. They have a functional hand at this point, but Don't be on top of buildings with exhaust fans in Fort Worth. It's not a good idea. The next story is, we call it the hostage surgeon story. And that's, again, Parkland Hospital. So much happened at Parkland. I mean, we could sit here hours and hours telling you stories, but Parkland ER was the busiest place in the Southeast, if not the country. It was a Saturday, and I was going down to the ER late one morning on a Saturday morning. And when the door opened, usually you would see at least 15 to 20 people running around trying to get all this work done. And the door opened, and all I remember was there was nobody in sight. There was no noise, and it smelled like somebody had set off a firework or something. And it was really odd. It was surreal, and I was just like, what is going on? So I just kind of looked around. I didn't see anybody. And then about 2 or 3 seconds later, I start seeing like a couple little heads pop up over the counters, like, what's going on here? So what had happened was there was a person that was incarcerated that had been injured. The police had brought them in. And at some point, just before, probably when I was coming down the elevator, that person incarcerated had grabbed the police officer's gun somehow, fired it. Luckily, it didn't hit anybody. I think it went into the ceiling. But then he grabbed the pit boss, who was a female friend of mine running the ER, and kind of tried to make an escape with this hostage. And luckily, he released her on the way out, but he ran out the Parkland emergency room and down the road that came up to the Parkland ER. He was subsequently apprehended, like literally within a minute and a half. He got shot, I think, in the leg by a police officer. And then obviously he comes back to the Parkland ER, and guess who has to triage him? Well, the surgeon who he had just apprehended as a hostage for a period of time, which was crazy. So anyway, all of that had gone on. And when I came down, that was just the aftermath after he had shot and he had run out, and everybody was just trying to take cover. Luckily, everybody else was fine. They were a little bit shaken up. It was one of these things I think that's the only time that I've ever heard of a surgeon, certainly somebody I know, being taken hostage with a patient encounter. And then she had to treat the patient after. So think about that. The third story is there was a patient who had a very unfortunate condition, which necessitated him having what's called a colostomy, is where they divert the intestines and it kind of comes out onto their abdominal wall. And that's to allow other things to heal. And so this person had been through this, but they kept having a lot of complications. And it was poorly understood why this gentleman was continuing to have all these wound complications and things. And finally, he was at the final stages to have the last final thing he needed to have done before he would be deemed healed. So he had that done uneventfully, went great. And then it was the second post-operative day after the surgery, and our chief resident goes into this guy's room, and the guy looks up at him. He's doing something on his stomach. Turns out he actually had picked his stitches open, and he just pulls his intestine out of his wound and looks at the chief resident and takes a scissor and cuts his intestine in half. And turns out that's what we call, it's called Munchausen syndrome, and it's a psychological disorder. But he basically was a self-mutilator, and that really explained a lot of the things that were going on with him that nobody could explain. And actually, what ended up happening with that gentleman, he finally did heal, but the senior level faculty surgeon at the time said, well, you know what we're going to do with this guy? We're going to close him with German silver wire, because you can't cut through that. You can't open it. And so we kind of had to re-anastomose everything and closed his abdomen up with something that he couldn't self-mutilate. And it's a crazy story, but it's true. So that is some full throttle dinner time stories that hopefully you enjoyed. But if you like this, check out this video on plastic surgeons identifying misleading TikToks.